This is Union Health Today.
Remembering this little boy's story could save the life of or injury to another child. I'll have details next.
We are where you are, ready to serve you and your family with compassionate health care of the highest quality, serving the Wabash Valley since 1892. Union Health, healthier together.
Last July, Chris O'Neill had to run a few errands after lunch, so he dropped off his then 6-month-old son, Colson, with their babysitter. A few minutes later, Colson went down for a nap.
We did have a conversation about as far as like where he should sleep. Like if she didn't have anywhere else, she could put him on the floor, away from where other kids could step on him. And we sent sleep sacks with him, but I didn't actually go in and check to make sure she had a crib, that nothing was inside of it, and tell her to not put anything in it. I just assumed, since her baby was around the same age, that was a given. But I wish I had now. She had went in and checked on him, and he was sleeping. Everything looked okay. And then 15 minutes later, she went to check on him. Oh, sorry, baby. 15 minutes later, she went to check on him, and that's when he was purple and breathing, she said, just like 1 or 2 times a minute.
Colson was rushed to St. Vincent Clay Hospital by a Brazil police officer, then airlifted to Riley Hospital for Children in Indianapolis. An unsafe sleep environment had nearly cost Colson his young life.
If I could go back in time and do anything differently, it would be to, skip what I think is an unpleasant conversation. I wouldn't skip that. I would have that with her. I would follow through and make sure wherever he was sleeping would have been a safe spot.
So infants are at highest risk for SIDS between the ages of 1 to 4 months of age, but continue to be at risk for SIDS up to 12 months of age. It does not discriminate. Anybody can die or have a incident related to an unsafe sleep.
The final part of Colson's story next week on Union Health Today.